What is occupational therapy, you might say? Because in my bio, Ms. T actually noted that I was an occupational therapist. And so those three words that you see there describing passion and purpose and possibility, I think those are great ways to define what occupational therapists do. So just to give you a little bit about occupational therapy practitioners. We help people of every age do the things that they want to do and they need to do in a therapeutic way to be able to function and use everyday activities. We focus on daily activities to help people remain as independent as possible despite any illness or injury or disability that they might have. Also, as occupational therapy practitioners, we teach people who are at risk for falls how to do things safely, and we also teach them how to manage things that are important to them. Occupational therapy practitioners work with people generally after they've had a fall or fall-related injury because our focus is helping them return to things they need and want to do. And so I can't see your hands and I can't see your comments. And some of you may be really good at using the chat feature there. But if I was in a room with you, this would be the point I would say, how many of you know someone who's fallen? Or how many of you have experienced a fall for yourself? So put a pin there and think about it. And I see in the chat that, 2 people have raised their hand. Maybe 3 now, 4 is kids continuing to grow because we have seen people that have fallen or we know people that have fallen. So yes, I see the hands continuing to go up. Thank you for your interactions there. I appreciate that. Okay, so now we're gonna go on to the next slide here. And so this is some information to ask you, did you know? Okay, and we're gonna go over some statistics. But fall death rates in the United States have increased. And you see that number, they've increased up to 30% from 2007 to 2016 for older adults. And you see that alarming statistic there that if rates continue to rise, we can anticipate that there'll be 7 fall deaths every year, every hour by 2030. That's very alarming and very serious. So falls has been noted to be actually a public health crisis. And other statistics around falls is that I wanted you to know that every second of every day, an older adult, 65 or older, falls in the United States. And every 19 minutes, an older adult dies from a fall. So in thinking about that and hearing those statistics, those things are alarming and concerning for us, so much so that it was so important for us to do this presentation. So now we're going to talk about some myths busted around falling because I hear this a lot. So the first myth is, I'm not going to fall, I'm in good shape. And that's a myth. Because 1 in 4 older adults experience a fall, and this fall can lead to a hip fracture, it can lead to broken bone or head injury, and ultimately resulting in a loss of independence. Another myth that I hear is falling is a normal part of aging, and we just simply must deal with it. And that also is not true. So falling is not a normal part of aging. And by the end of this presentation, we will learn ways to prevent falls. Another thought is, well, if I've had a fall, if I limit my activity or I stay in home, I won't have another fall. And that's also not true. Because staying at home or limiting your activities will not reduce your risk of falling. In fact, it could cause you to lose some of your independence. It could cause you to lose some of your strength, and it could put you at risk for being socially isolated. So staying at home is not the answer. Another myth there, I haven't been exercising, and at this point, I can't gain any of my strength back, so why bother? Well, that's not true either. It is true that we do lose muscle mass as we age. However, exercise can partially restore strength and flexibility. So it's never too late for you to begin to exercise, start an exercise program, and build strength. And lastly, there I have using a walker or cane makes me dependent. That's not true either. Because walking, a walker or a cane is used as a walking aid, and it can actually help increase your independence because it could increase your safety. It can improve your ability to get around your home or the community. But the one thing about these devices is you need to make sure that these devices work and are safe for you, okay? So you may need your doctor to refer you to a physical therapist or an occupational therapist so we can make sure that those devices are working correctly. So why do falls happen? Falls will happen because of age-related changes. As we grow older, our body changes, and that's the reason why falls can occur. Falls occur because people have changes in vision. So again, as we grow older, our vision changes, and that could cause problems with the way we see things on the floor, the way we have a perception and depth of things on the floor. So all of those things can impact a fall. We can make us trip, and then we have medications sometimes. So oftentimes we don't think about medications making us fall. But some prescriptions and over-the-counter medications can cause us to experience dizziness or dehydration, or interactions with each other can put us at risk for falling. Other things are environmental factors, and we'll talk about that a little bit more later. But most of us, and I would say most of those that are 65 and older, they've lived in their homes for a very long time. And they've never thought about simple modifications that actually might keep them safer in their home as they age. And then we have underlying health conditions. So chronic conditions put us at risk for falling. So more than 80% of older adults have at least one chronic condition. And that could be a condition like diabetes, or it could be a previous stroke or a history of arthritis. And often these things increase the risk of falling because they result in a loss of function or inactivity. They might result in a loss of normal sensation. They could cause pain. We might be on multiple medications because we're at risk of these conditions, which put us at a greater risk for falls. And then sometimes falls happen in general just because of an accident. Simply is something that we could not prevent. We just had an accident in the home or in the community. So then when we talk about fall risk, there's some things that you can change, and then there's some risks that you cannot change. So risks that you can't change is you can't change your age, you can't change your gender. If you have a history of falls, well, you can't change that because you've already fallen. And then there's certain chronic conditions that we can't change. So a history of a prior stroke, or if we have Parkinson's disease or dementia or sensory deficits, we can't change those things. But some of the risk factors that you can change include physical inactivity. If we're not active, we can make a plan to get more active. Balance, we can make a plan to work with a therapist to work on our balance. Mobility deficits, again, there's a solution for that in working with someone to improve that. I'm going to go back to the ones that have the star beside them. But then you see improper use of an assistive device that could put you at risk for falling, and that's a simple fix because you work with someone who can teach you how to use it properly. And then the last couple of things are the things I have stars by or asterisks, is some of these things such as a home environment, visual impairments, medication risk, those that are incontinent. These are some modifications, or they require modifications that require a team approach from maybe your physician, your family, the therapist working with you. And so some of those things you can change, and it might seem like you can't change it, but you can work around and come up with modifications to help make things safer for you. So this slide, I'm focusing on here, if you or your loved one is at risk for a fall, or anything that I've said so far resonated with you. The National Council on Aging, they provide this great tool. It's a falls free checkup, and it's a free tool that you can go online. You can answer a series of questions to find out if you are at risk for falling or if your loved one is at risk for falling. And below here, there's a link. If you just look up the National Council on Aging, or if you go directly to the nationalcouncilonaging.org and just type in their search falls free checkup, you can find this tool. But it takes you through a series of questions, and at the end, it gives you a number, and that number will let you know what is your risk for falling. So I encourage you all to check that out. So there's other fall risk factors, and we're going to go in depth with these a little bit more. But the three main things that put us at risk for falling is physical risk, behavioral risk, and environmental risk. So we're going to touch on all of those now. So physical risk. Physical risk is as simply as decreased balance or visual changes or chronic conditions that one might experience, okay? Physical risk factors, they relate more to changes in your body that can increase your risk for falling. So you see the decreased balance, the visual changes, the chronic conditions, all conditions affecting the body. So next we'll go into recommendations for things like decreased balance. So if you or one of your loved ones is experiencing decreased balance, first identify your fall risk. Do the falls free checkup and see what is your risk level. Then talk to your doctor about changes you're experiencing. So let's figure out why you are experiencing those changes. And then begin with an assessment. Talk to your doctor for a referral for a physical therapist or occupational therapist visit to assess your balance. Locate an evidence-based falls prevention class. So these are classes that might be at your local senior community centers. And a lot of these right now, they might be offered online virtually because of the space that we're in and the need to social distance. And then be sure that the classes that you're attending are for your age group and your ability level. That's important. You want to be in an environment where you feel like you belong. Another thing that can affect balance and can be helpful is that you develop a routine exercise program. My caution here is you talk to your doctor first. If your doctor says that it's safe for you to exercise, then that's wonderful. That's something that I would love for you to get involved in doing. But you want to check with your doctor first to make sure that your health is in good condition and you can do it and that you're safe enough to do it. But what I've provided you here is just an example of some free things that are out there. And this is through the National Institute of Aging. It's called an Exercise and Physical Activity Guide for Healthy Aging to get fit for life. And in this particular free online information or booklet here, you can print it. It goes over balance exercises that help prevent falls. It talks about safety tips while you're performing these exercises. And generally, it lets you know that exercise is going to improve your muscles. It's going to make you stronger, which is going to help improve your strength and your balance and your flexibility. And so working with a professional, such as a physical therapist or occupational therapist, especially when safety is a concern, is the first step you want to take. But if you are already generally a healthy individual and your physician has cleared you to exercise, a normal exercise program would be a great benefit to you. So now we move into the behavioral risk factors. So the behavioral risk factors can be anything from, it's what you do. So the things that you do, the behaviors that you exhibit at home or in the community. It could be as simple as reaching for an item in an overhead cabinet, picking up an item off of the floor, or standing on a step stool or ladder. And those are things that we can change, okay? Those are things that we don't have to do, but they put us at risk. Environmental risk are things that are present in your home that cause us to be at risk for falling. So example here, these are the 3 common places where people often fall. So you have your home entry, and sometimes that's because handrails, they're not sturdy. You have uneven surfaces from one step to the next. or it's cracks in the sidewalk, or there's doormats and they pose a tripping hazard. And then you have the bathroom. The bathroom, sometimes it's due to poor lighting or a slippery tub or shower, or maybe it's simply the toilet height. And in the kitchen, oftentimes fall risk factors are items that are out of reach. We use a step stool to get those items. And then sometimes we trip up on throw rugs that are present in the kitchen. So those are all environmental factors, and those are things that we can change through some simple modifications. We can, for the kitchen, we can move things that are out of reach to the counter height. For the bathroom, we can put down a non-slid mat, or we can use a shower chair. For the home entry, for those little loose handrails, we can get a handyman to come in to fix those things for us. So those are all things that we can adjust and modify. So environmental recommendations or other environmental recommendations are identify and eliminate those fall hazards in your home and your community. Have a conversation with your doctor regarding if you might benefit from a referral to see a physical or occupational therapist. And then seek professional assistance from a certified agent in place specialist. These are specialists that do home safety assessments, and they come to your home to do the assessment to eliminate fall hazards that are actually in the home. So now we're going to talk about some additional fall risk. So vision. I briefly talked about vision earlier, and I said vision is was one of those asterisks that with modifications you can do something about. So visual function, as we spoke on earlier, it does deteriorate as we age, okay? And this can increase our risk for falling. Decreased vision can also contribute to decreased balance. So one of the things I'm recommending for you all is to make an eye appointment for a yearly exam. So your eye professional can let you know how well you're seeing, to make sure you don't have any presence of a cataract or glaucoma. And then speak to your eye professional when you go about the changes you're experiencing. Don't ignore those visual changes that you are experiencing. And it's important because whether you know it or not, you don't have to be 65 or older. It's a statistic that more than 12 million Americans 40 years of age or older experience a visual impairment. And it's very important to have at least one eye exam a year. So please remember that. And then if you're experiencing vision problems because of a chronic condition like diabetes or glaucoma or macular degeneration, you might need to see an eye doctor more frequently. And then your fall risk can possibly decrease if you follow up with an eye doctor. If you follow up with their recommendations to get some surgery to get a cataract removed. If you work with a therapist or a certified agent in place specialist to help you with contrast for an item on the floor so the color looks different. Those are all things that you can do something about, okay? Then the other thing that comes up is medication. So medication is one of those things that is kind of little known fall risk, I like to say. But medication can cause us to fall. Side effects can make you dizzy, and it can increase your fall risk. One of the things about medication that's key is use one pharmacist. And when you use one pharmacist, that pharmacist knows all of the medications you're on. You know the pharmacist behind the counter, and they're able to review your medications with you. So I would encourage you to ask for an annual medication review with your physician. Ask your pharmacist to review new medications with you, and be sure you can read all of your medication labels. That's really, really important because you want to make sure you know what you're taking. And sometimes with medications, it might benefit you from using a pill box to help you, to make things easier for you. And then we're going to talk about blood pressure and fall risk. So it's important that you check your blood pressure regularly at home, especially if you have some issues or concerns with your blood pressure. It's important for you to know that when your blood pressure actually drops, that means that less blood can go to your organs and muscles, and this can make you more likely to experience a fall. So if you've ever gotten dizzy when you stood up, you need to talk to your doctor about that, because that might mean that the doctor needs to do a test called the sit-to-stand test, so they can check your blood pressure sitting and they can check your blood pressure standing to see if there's a drop or fluctuation in your blood pressure. And then some blood pressure medications can increase your risk for falling. So read those, the caution on the blood pressure medication, and talk to your doctor. And then be very careful after beginning a new medication, because you do not know how that medication will affect your body. And then the other thing there that you see is there's this pamphlet that I included here, which is from a program called STEADY. It is a program recognized by the Center for Disease Control that they are attempting to raise awareness in fall prevention in older adults amongst medical providers. So there is a lot of different handouts that are on the CDC website under the STEADY program to focus on risk factors and falls. So this particular handout talks about postural hypotension. And what that is what I refer to, that sit-to-stand test. That just simply means that when changes in my posture, if I go from lying down to sitting up or sitting up to standing up, my blood pressure may drop. And so it talks about that in this brochure. It talks about the symptoms of that. And so I encourage you to definitely check out some of these resources that I've put up on the screen here. So tools for caregivers. So if you're caring for someone that is at risk for falling, again, the National Council on Aging, they have some great tools. They have a falls-free initiative, a falls-free program, and there's actually a falls prevention conversation guide for caregivers. So again, if you're caring for someone and this is of concern to you, you want to make sure that you go out there and take a look at that guide for tips and tools for how to better care for your loved ones. And the other thing I'll say here is that, you know, research has actually shown us that a care recipient's first fall, after a care recipient's first fall, caregivers often report a significant increase in caregiver burden, fear of falling, and depression. Because oftentimes as caregivers, we're afraid that, you know, grandma or mom or dad, they're going to have another fall. And sometimes we even feel guilty about that fall. So this is a great resource and tool for you as caregivers to read, to say, hey, what are some things that I can do to let you know that you are doing some of the right things as well. So if you have a fall, what should you do? And so I'm going to go over the steps next of what you should do if you experience a fall. So the first thing you need to do is you need to stop and you need to take a deep breath. You need to just remain still on the surface, the floor, for a few moments and calm yourself down. Then you need to maybe wiggle your toes, move your arms, because you need to decide if you feel as if you hurt yourself. If you're not hurt, then you can proceed to slowly move to an upright position and get up. If you are hurt and you cannot get up on your own, ask for someone else to come and help you, or you may need to call 911. One of the things that I recommend is for those that are at risk for falling, there is a device called Lifeline, a life alert system. That is a particular brand, but there's others. You can wear something around your wrist or a necklace on your neck. If you have a fall, you can push a button. The other thing you can do is if you have a mobile phone, you can carry your mobile phone with you. You can put it in your pocket or your little pouch so that if you do experience a fall, that you can call someone quickly. So now we're going to go through the steps. So you found out that you were okay. You didn't hurt yourself. So now what do you need to do to get up off that floor? Okay. First, you're going to roll over on your side. You're going to slowly get up on your hands and knees, and you're going to crawl to a sturdy surface. So that could be the chair, that could be a couch, okay? Then you're going to put your hands on the chair, on the seat of the chair, and you're going to slide one foot forward so it's flat on the floor, and you're going to keep the other leg bent so that the knee is on the floor. And then from this kneeling position, you're going to slowly rise and turn your body to sit in the chair. So I almost wish I could do this while I was talking through it, but what I did was on the next slide, I actually have a picture that takes you through the steps. And this photo is actually provided by the company that has the Life Alerts, Lifeline. But first it says you prepare. So they're lying on the floor, they're making sure that they're okay. And then you see them getting ready to do that second part, which is the rise. They're pushing themselves up. They're getting to a position where they can slowly crawl to that chair that's there. They're placing their hands on the seat of the chair. They're sliding that one foot forward, okay? And then you see one other leg is on the floor, one foot is nicely planted on the floor. And then you see them from that kneeling position slowly rise and turn their body to sit on the chair. And then that last photo there says sit for a few minutes before you try anything else. And you need to talk to your doctor after you've experienced a fall, because you need to figure out what happened. What went wrong that you experienced that fall? Because having one fall means you're more at risk later to have a second fall. So what are things that you can actually do? So now you've identified, I'm at risk for a fall. Now you've seen, I had a fall. These are things that you can do now. Schedule a regular appointment with your medical provider. That's your primary care physician. Talk to your physicians and your pharmacists about your medications. Is there anything that you're taking that's going to put you at risk for falling? Stay active and exercise regularly. So remember my note of caution earlier. If you can and are able, that's what you want to do. Find alternatives for potentially risky behavior. So those things in that home environment that were risky, identify them, and let's make a plan for how we can eliminate those hazards. And I said that already, eliminate those hazards. But then if you're a caregiver, what can you do? So as caregivers, it's we put sometimes a lot of weight on ourselves. So have a conversation with your loved ones and identify what their concerns are. You know, do you have a fear of falling? A lot of times I find people who are afraid to fall. They may have never fallen, but they're afraid to fall, and that puts them at risk for falling too. So have a conversation about their fears. Ask questions about their current health conditions, you know, what some of their other conditions are that you may not know about. Ask them about their latest eye exam. Remember, that's important. As we age, our vision changes. So when is the last time you went to the eye doctor? Pay attention to their environment in their home when you go for a visit, and pay attention to their behaviors, okay? What is is their bathroom cluttered? Is their bedroom cluttered? Can they get to the bed from a chair? Can they get to is there a path that they can actually walk on? Those are things that you can look for as a caregiver. And then talk about their medications with them. Well, what are you taking? Do you know why you're taking that? Does that have any risk? And if they don't, then that goes back to let's have a conversation with the pharmacist or with the doctor. And then you might need to recommend additional services for them. Like what other services are available that they may need. And down there on the bottom, that little picture there, you see, it says fall prevention is a team effort. And it really is. It takes all of us to keep everyone safe. So families and friends contribute, your physician and other healthcare providers contribute to keeping you safe and preventing your risk of having another fall. So now what? So I told you all of the things you can do and what you need to do if it's for you or if it's for a caregiver. So the presentation is going to end soon. So you're like, now what do I need to do? If you or your loved one is at risk for falling, or if you've identified, you go and you do the falls checkup and you've identified you're at a high risk for falling. First thing you want to do is you want to seek professional assistance. I'd probably have them out of order, but you want to have a conversation with your doctor. I'm going to move that one back. You're going to have a conversation with your doctor regarding your risk. You might benefit from a referral from an occupational or physical therapist, whether that's an in-home assessment or an outpatient assessment. You might need to seek that professional assistance from a certified agent in place specialist. Again, those are the individuals that come in and can assess your home and see what your falls risk are. I will put a note here that currently most certified agent in place specialists, they do not take any type of insurance, and it's not covered as a benefit of Medicare or private insurance. That is a private out-of-pocket expense. However, I do know that that's something that's really being pushed because that would be a great service to be provided to be able to help older adults out. And then you're going to look for community falls prevention programs that you can participate in, whether that be virtually, online, or whether that be something that you attend in person later when you feel comfortable. And then if your care team has deemed it safe, you want to begin a routine exercise program, something that you're doing. The recommendation is 5 or more days a week. But start small. Even if it's only 10 minutes of walking after each meal and you do that breakfast, lunch, and dinner, you'd have 30 minutes every day. So start small with something. But most of our falls that we do experience, they do occur in our own homes. And so there might be simple and inexpensive ways to make your home safer. And so with this team approach and speaking to all of these different professionals, they might be able to make some recommendations for you. So just to summarize today, kind of what we talked about or what's important for you to be able to manage these chronic conditions and these illnesses, that's going to help you reduce your risk. If you can manage chronic illness or conditions. You want to look for participation in a community falls prevention program that can better prepare you or make you safer for home. You want to get an eye exam regularly, so following up with your eye doctor at least once a year for changes in your eye. I have stay hydrated here, one, because of the heat, but two, if you do decide that you're starting an exercise program, you're going to need to stay hydrated, but also hydration for the purpose of you don't want to get dehydrated, because sometimes dehydration can cause problems with you feeling dizzy, which could then in turn cause a fall. You want to talk to your physician and your pharmacist about medications. Periodically, our medications change. So getting an updated list from your pharmacist and then from the physician and matching them up to make sure that you're still taking those medicines or you still need those medicines. You want to stay active and exercise regularly if you can. And then you want to find alternatives for potentially risky behaviors that you're doing at home. So if you know that you have some risky behaviors after listening to this presentation today, think about what things that you can change or you can work with someone to change in your home. So again, this is a reference from the National Council of Aging, but they provide you 6 simple steps to prevent a fall. And so in the previous slide, I think I covered most of those steps, but just to review, find a good balance and exercise program. Talk to your healthcare provider, and it says there, ask about an assessment for your risk of falling or share your recent falls history. The third thing there is regularly review your medications with your doctor or your pharmacist. The fourth thing is get your vision and hearing checked annually and update your eyeglasses. The fifth thing is keep your home safe. So removing tripping hazards, increasing lighting, making stairs safe, installing grab bars if needed. And then the last thing there is talking to your family members. So enlisting their support and taking simple steps to stay safe. Because it says there, which is really important, that falls are not just it says a senior's issue, and it's not. Falls is, all of us are affected by falls, and it becomes everyone's issue. So in closing, something that I want you all to remember is that falls are not a normal part of aging, and falls can definitely be prevented. So I want you to remember that, and everything that you do and you say is that this does not have to happen. This is not a normal part of aging. I can be safer. And my last slide here is just a list of resources. Some of these things are things that I referenced in my slide presentation, and I would encourage you to go to some of those sites like the Centers for Disease Control or the National Institute on Aging or the National Council on Aging for some of those resources that I discussed that may be of benefit to you personally, or if you are a caregiver, that would be able to help you out and your loved one out. So I think that concludes my presentation, but now I'm going to hand it back over to Ms. Angie Body, the Director of the Health Promotion Program.
Thank you, Keisha. Thank you very much for your thoughtful and thought-provoking presentation. I know I certainly have a few questions for you. But before I ask my question, I'd like to invite our audience to post their questions in the chat. And so while we wait, I'd like to ask you a question for myself. Can you speak to the importance of weight-bearing exercises as we age?
Yeah, so weight-bearing exercises, those are exercises that focus on strength and building muscle mass. So things like a sit to stand, things like a simple chair squat. And what those exercises do is they build strength. And strength helps our muscles continue to be able to grow and us to be able to continue to use our muscles. So those weight-bearing or strengthening exercise, they improve our ability to be able to stand, to walk. They improve our balance. So those are very, very important exercises.
Okay. And just building off of that question, do I have to join a gym to participate in weight-bearing exercises, or are there things that I can do at home that will help me with those type of exercises?
So no, you don't have to join a gym. A lot of times we think we have to join a gym to be successful at implementing an exercise program, and that's not true. So if you wait 1 second, and I'm going to move back through the slides, and I'm going to go backwards, but this interesting program through the National Institute of Aging here is one of those examples. This is a great exercise program. It's available online. And it gives you, if you see the pictures there, it gives you a demonstration of exercises that you can do at home, and it provides you safety tips. So these are things that you can do in your own home. And it gives you even safety tips for you to do, as long as it's cleared and okay by your doctor. And then lastly, I'd like to say walking. Walking is the simplest form of activity and exercise that everyone can do in small increments. And so those are some of the things that I would encourage you to do at home. Now, Ms. Angie, I see that there is maybe 2 questions
Yes.
in the chat. So I'd like to read those for a minute, if you don't mind.
Yes, please.
Someone said, can we get a copy of the presentation? You most certainly can. I will give that to Ms. Body and Ms. Telesford so that they can provide it to those that are interested in the presentation. And as I mentioned at the start of this was recorded. And so later, I think this will be posted on the Health Promotions website so that you can view this presentation again. And the second question is, what advice do you have for an older caregiver of a young child regarding fall prevention? How can the older caregiver do some precautionary things towards prevention? So a younger, let's see, I'm gonna take it in 2 parts. So an older caregiver, that has a young child. And I don't know how young the child is, but it depends on what you're doing with the child. If you have to pick up the child or you have to lift the child, if you have to do a lot of things that require you reaching and moving with the child, I think it's important that you know, okay, you need to make sure that your balance is stable and that you are good, because by doing some things with the child, you might put yourself at risk for falling. So I would say go on the National Council of Aging Falls free checkup and take the falls risk assessment to see if you are a risk for falling. And if you are, it might dictate some of the things you need to change with helping to provide care for that younger child. And then the second part of that was, how can the older caregiver do some precautionary things towards prevention? Again, I think once you've identified what your risks are, if you are at risk, the first thing you can do, the best thing to do, is to start exercising and start focusing on your balance. So identify what balance exercises are. And in this capacity, I'm not being an occupational therapist, I guess, but I can't change that. But I would recommend you, if you're not sure of what exercises to do, or if you're safe enough to do them, first talk to the doctor, maybe get a consult to some therapy services. And so they can work with you to develop a routine, something that's safe for you. Or look for some other wellness programs that are out there. And so, yes, ma'am, you can get a copy of the presentation. We will take your information from the chat and send that to you. And then some other questions that I have here. Are there any federal or state assistance programs available to renovate my home for falls? So there are different programs that are available, and these programs, they all, I guess, have their own, requirements. So if you are a veteran, there's programs maybe through the home and community-based services that you can qualify for home modifications. The local area agencies on aging, they're a good resource to reach out to if you need some help identifying, is it help or assistance available in my county, my region, my state, to help me modify my home. It's another program. It's a group. It's called Rebuilding Together. And they provide low to no cost home modifications for seniors in certain areas. I know Rebuilding Together is present and active in the DMV area. Outside of our area, I do believe it's a national organization, so there are smaller Rebuilding Together agencies, but you can look them up. They'll come out and do a home assessment based on income. And then again, federal programs, if you have veteran benefits, there might be some programs that are available. And then the local area agencies are probably the best place to start for that. Let me see, other questions. As I get older, is it normal for walking speed to slow down? So yes, that is normal. So as we get older, our body, I always said, I had a physician once tell me, your body is like a car. So the older a car gets, it slows down and needs some repairs, and you got to get things fixed on it, and it needs to tune up. So same thing with our body. But as our car gets older, it definitely slows down and doesn't go as fast as the new car. And so the same thing happens with our body. We slow down, our walking speed changes. And if we don't do things to routinely keep that speed up or keep our physical fitness up, then we will slowly decline in our health. Another question here. So I heard that if I fall, I would end up in a nursing home. Is that true? So that isn't true. So sometimes someone experiences a fall, and maybe that fall results in an injury, and that injury causes them to have to go to a hospital. And maybe it does cause them to have to go to a skilled nursing facility for a short time to improve and get better. So skilled nursing facility, which is a nursing home, and they may have to be there for a short time to get better. It is the goal that you will then be able to return to your home. And again, I say that is the goal because sometimes it's not permitted that we can return to our home because we just simply aren't safe. And sometimes that happens and we identify that. But just because you had a fall doesn't mean that you'll end up in a nursing home, because you have a chance when you work with health professionals, you work with a therapist, that you can safely return to your home environment. Let's see here. Do I need to wear sneakers all the time? You don't need to wear sneakers all the time in your house, but if you are beginning to exercise, you're walking, I would recommend good supportive shoes in the form of something with like sneakers. So I wouldn't suggest that you wear some flat shoes with the back out to walk. So yes, sneakers would be the safest thing for walking and exercising. Let's see, does Medicare, Medicaid, and private insurance pay for occupational therapy? So yes, so if you're a physician, if you're having difficulties at home, and you're no longer able to function independently, you have problems with strength, you have problems with independence. We call it your activities of daily living. So your ability to dress yourself, bathe yourself, your ability to transfer on and off the toilet or get in and out of the shower. You may qualify based on that for some in-home services or outpatient services. And that's a matter, again, having a conversation with your doctor, telling your doctor what's going on, and then your doctor can write a referral for therapy services. And that might include the gamut. If it's in-home, maybe a nurse, a physical therapist, and an occupational therapist comes out. If it's specifically for one problem, maybe it's an outpatient therapy service, but Medicare, Medicaid, and private insurance does pay for those services. Let's see, will my landlord help me with home modifications? So if you live in a senior building, and they're following ADA, the Americans with Disabilities guidelines, there may be an opportunity for the facility or the building to have maintenance do some modifications to make your home safer. They will not always know what the modifications are unless they have been given information about those modifications that are needed, because you won't always know what you need. Along with being an occupational therapist, I am one of those certified agent in place specialists. And so when I go into someone's home, I look to see what they need and I make those recommendations. But someone else might not know that, but they could possibly make some modifications. If you live in a private home and maybe you rent, that is something that you can talk to your landlord about to see if they can provide something as simple as a grab bar, or something as simple as, tightening up the rail to get in and out of the house. So those are some things that they may be able to do. Let's see. My friend recommended Tai Chi. Will that help me? So yeah, so Tai Chi has been an evidence-based program. We see that Tai Chi helps balance. Tai Chi is I would say, an ancient form of movement, slow and coordinated movement. I actually used to do Tai Chi. It's very fluid, calming motions. But I would suggest there is you want to make sure that you find someone that is certified in doing it, a safe environment where you can do it so that you don't have a fall, and identify your own fall risk before attempting to engage in Tai Chi. Let's see. During COVID-19, we are wearing masks sometimes impede vision. Any recommendations with wearing masks? I would say I don't probably have a recommendation for wearing the mask that impede your vision, other than oftentimes I see people, they'll have on a mask and the mask will be way up here and it'll be under their eyes. So that is going to impede their vision. So just when you wear your mask, you want to have it definitely covering your nose, but there is always a little metal piece on the mask, if it's the cloth mask or the surgical grade mask, that you can actually pinch down on to keep it from riding up. I work in a hospital, and sometimes I even have to put some clear tape on the bridge of the mask so it doesn't slide up, but that might help so your vision is not impeded. But you need to keep your mask on. So if that becomes a problem, you don't have to go out and exercise. You can simply walk around in your house if you need to. Let's see. There was another. I am uncomfortable going to my senior center because of COVID-19. I don't have internet connection. What should I do? So if you're uncomfortable with going to the senior center, I definitely understand that because of COVID-19. And if you don't have any type of connection to be able to get on a computer to locate some of these resources, then what I would definitely tell you to do is start with your doctor. Start with your doctor so you can see, okay, doctor, I have a problem or I don't have a problem. I can come in to see you, and your physician may have resources that they can give you, handouts that they can give you for exercise programs. Also, some of these, like the NIH brochure here, it is available by mail. So reaching out to maybe your area agencies on aging to say, hey, do you have any? And you can look up that in phone book. So look up what's local in your area, or have a grandchild or a daughter or a son look it up for you, the number, so you can call and say, hey, is there any exercise information or guides that can be mailed to me? That's also an option. So probably I have time for maybe 2 or 3 more questions, but do churches have falls prevention classes? Some local churches may. Right now, I would say a lot of falls prevention classes, a lot of in-person classes have been halted because of COVID. But maybe in the future, these classes will go back to churches. I often find the falls prevention programs are more at community centers. And I haven't seen very many at churches, but that would be something good that you could perhaps present to your church. And then let's see. Oh, our falls prevention classes are expensive. So I would say that they aren't expensive. Some of the local senior centers that offer them, depending on the area that you're in, they could be free. They could be, I've seen some as little as $10 for maybe a 5 or 6 week series. So the price depends, but honestly, I haven't seen any that are really expensive. A lot of these programs, sometimes they're funded by federal grants to keep our population 65 older safer. And so some of these programs, there is little to no cost with them associated with them. And then can you please repeat what I need to do if I fall? Okay, so can I please repeat what you need to do if you fall, especially if you live alone? So let's do that. I'm going to go back to that slide and I'm going to talk through those steps. Let me see. So excuse me again as I move through. All right, so I am going to kind of read through my steps here. So the first thing you want to do is, and this was on my side presentation, is you want to be calm. You've fallen, you're afraid, you want to be calm and make sure that you're okay. So you lay there for a minute, collect your thoughts. Remember I said wiggle your toes, your fingers. Make sure you're not seeing stars. You want to make sure that you're okay. Says once you know that you're okay, then you can proceed to get up. If you feel that you're not okay, if you see blood coming from someplace, then you're going to call 911. Okay. So if you feel okay and you can get up, then we're going to go through the series on the picture here. Says under prepare, that photo number 2, look around for a sturdy piece of furniture. And don't try to stand up on your own, but first identify a sturdy piece of furniture. Then that third picture, you're going to roll over or crawl over on your side, and you're going to attempt to reach that piece of furniture. Then in step 2, you're going to work on the rise. You're going to push your upper body up. You're going to lift your head up. You're going to pause and make sure that you're steady and you're not dizzy. Then you're going to slowly, on your hands and your knees, you're going to crawl to that sturdy chair. You're going to place your hand on the seat of the chair, and you're going to slide 1 foot forward so it's flat on the floor. And then the third step is you're going to move into that seating position or the sitting position. You're going to keep one leg, that 1 foot flat on the floor. You're going to keep the other leg bent. And then from this kneeling position, you're going to slowly rise and turn your body to sit in the chair. And lastly, you're going to sit there for a few minutes and you're going to make sure, okay, am I okay? Do I feel okay? And if you need to at that point, you're going to call someone, let them know that, hey, I've fallen, I'm okay, but maybe you come check on me later. Or you're going to definitely call your provider, your physician the next day to say, hey, I fell and I think I need to come in and see you. Because you want to, remember I said you want to know why you fell. And if there's no explanation for it, you need to review and check what's going on with your medicines, if anything needs to change. Okay, and how am I on my time? I think I'm right at time there, but is there any other questions, Angie, that you would like me to answer here?
No, Keisha, again, thank you very much on behalf of NCBA. And I know our audience members, thank you so much for your thoughtful and thought-provoking presentation. I have some things to do in my home to remain safe. And so again, I just thank you and I thank our audience for joining us. And before we give you back your day, we hope you can join us on September 15th for a discussion about Social Security and how it benefits you and your loved ones. And so again, thank you, and we give you back your day.
Thank you. Have a good day, everyone.
Thank you, Keisha.